Thank you. All right, welcome everybody. Thank you for joining. Thanks for coming to tonight's virtual session on mental health resources. This is a continuation of Oregon Spinal Cord Injury Connection's ongoing sessions of educational forums. Tonight's forum will be recorded for our community members that couldn't attend. Please do not share any personal information that you aren't comfortable with being recorded. And we'd like everyone to know this is a safe space to share and ask questions, so please respect others' opinions and experiences. Please stay muted during all the presentation, and you can put questions in the chat or save them for the end. And with that, I would like to introduce Autumn and Beatty from Brightways Counseling Group, and I'll let them kind of do their introductions and take over screen sharing.
All right. Yeah, my name's Autumn. I'm the integrative care specialist at Brightways Counseling Group. And my role, basically, I'm the point person for our community partners, but I also help our clients who are established get connected to other services if they ever are in need of services that we at Brightways do not offer, or if they need like a higher level type of service as well. And then Beatty, if you want to introduce yourself.
Hi, everyone. Thank you so much for taking the time to join this presentation. And for those that might be watching it later, thank you so much for just being interested in mental health. I'm Vidi Pozos, and I am the clinical care manager for Brightways Counseling. I am a therapist myself. I was serving direct services for 13 years and then slowly made my way to leadership as a lead clinical supervisor and currently a manager for Brightways Counseling. I manage our 3 different locations on the metro side, which include Portland, Woodburn, and Salem. And we have a variety of clinicians that see children as 0 to any age adult with various specialties. And I will hand it over to Autumn so that she can do our lovely presentation. So it's nice to be here with you all. And again, thank you.
Thank you, Vidi. And yeah, so I'll share information about our services at Brightways. I'll share the PowerPoint in just a second here. But afterwards, yeah, we'll take questions. And if any clinical questions do come up, Vidi will be there to offer those supports with answering. So I'm going to go ahead and share my screen. All right, great. And just to confirm, does everyone see the PowerPoint?
Yes.
Okay, great. So yeah, we're a Brightways Counseling Group. Our whole goal is to get help to our communities now. And we do that by destroying barriers and making sure that we can get people in rapidly. So we are an award-winning counseling group. And we provide comprehensive behavioral counseling services. This includes therapy and medication management services. We do work directly with our referring providers by providing closed loop referrals. So basically any referral that gets sent to us, we will provide an update on that. So, if someone is referred to us and we're not in network with their insurance, we make sure to let the referring provider know, and then, just review again what insurances we are in network with. And then we ensure rapid access for our clients. So if interested in our services, our goal is to get people in within 2 weeks. And then we serve communities in Bend, Redmond, Woodburn, Portland, and Salem. That's where we have physical locations. But we also do serve the whole state because we offer telehealth services as well. So as mentioned before, our whole goal is to get people in fast. So rapid access, we have easy scheduling and referral system through our website. So people can get an appointment with one of our care coordinators immediately through our website. And then, we have in-person and telehealth options just for flexibility and to meet people with their preferences. And then as well, just as mentioned, we have access to our medication providers too. So I'm just going to share a video just more about our model as an integrative care model and just what that's about.
Meet Sarah. She's struggling with depression and has come to her primary care physician for help. But there is a large gap between where she is now and getting plugged in with a mental health counselor. That's where we come in. We partner with primary care to destroy barriers and get help to the community now. Patients are not waiting weeks or months to get care, and we provide closed loop partnered referrals for patients to step up and step down. So there are no dropped patients. We make rapid access easy for patients who need help now with PCP direct scheduling for in-person or telehealth appointments. We utilize a multidisciplinary approach, creating a medically informed treatment for counseling and medication management. Patients receive whole person care using evidence-based practices like EMDR, DBT, CBT, parent-child interaction therapy, play therapy, and many others. We use measurement-based outcomes and a collaborative approach to ensure patients receive the best care possible. When patients graduate from treatment, we collaborate with primary care to transition patients back for routine care, while also providing timely re-engagement if they need help again. We also provide closed-loop referrals to keep track of patients and clinical documentation summarizing their progress. When the patient steps down and is back in PCP care, we are still right there with timely re-engagement to help as needed. Redefining whole person care. Meet Sarah. She's struggling with depression. Meet Sarah.
So that's a little bit about our model, integrative care. We do believe in treating the whole person. We've had clients where they're presenting with bipolar and come to find it was just unmanaged diabetes. And that's how they were displaying those symptoms. So it's just, why we feel it's very important that we do partner with primary care. With that being said, though, we don't require a referral from primary care. Anyone can self-refer. And so with that, we do have that referral process where you can do so directly on our website. And we found that that direct scheduling has led to an increase of engagement and treatment. So if someone leaves an appointment and they have a scheduled time with a consult with us, that their engagement in those services increases 49%. So that's a big deal. And I'm just going to show how you can refer directly on our website. So bear with me. I'm going to open up the website and then switch what screen I'm sharing. Okay, great. Do you see our website? Okay, cool. So on our website here at the very top right is Seek Services. And that's where you can refer someone or self-refer. So before doing so, we have our insurances that we're in network with listed right here. So that can be reviewed prior to issuing a referral. We are in network with OHP, several CCOs. We're working on, getting more, being in network with more. And then we also have some commercial plans as well. There are some differences between our commercial plans for therapy and med management. So it's just worth looking at both. So how can we help you? So you can submit a referral for someone or for yourself. So if you choose, I'd like to submit a client referral, you'd put what practice. So I don't believe we have OSCI in yet. So we'll just do other new. And then you would put OSCI. And that way afterwards, we get it all added into our system. And I'll make sure OSCI is added anyways. And then what services are we requesting for this client? Therapy, med management, both. You don't have to have both. You can do either of them solely, or you can have both. So just do both. And then just for the sake of time, we're just going to, put in quick information. But there's only a few fields required, like name, date of birth, phone number. You don't have to complete every field, but it is, helpful, as much information that you're able to provide. But you don't have to worry about it either. We'll make sure to call the client and get the information. And then this is just confirming that, we're not going to send text messages unless you become an established client. And then at that point, you may get text messages just with appointment reminders, or from your clinician as well. So it's just acknowledging that. And then again, all this information is not required at the time, but you can put that. Any medical records or referral documentation that you think may be helpful in establishing care, you can attach here. It is HIPAA secure. And then referral notes, again, anything you might want to add. And then we just put the insurances here, again, just to, for extra. And then, so after you hit submit, that will automatically submit the referral. You don't have to schedule that appointment right away, but it is, we'll call the client and we'll schedule with them. But you do have the option, if you want to continue, to proceed with scheduling directly here on this calendar. So as you can see, we have appointments as soon as the 21st for the consultation. And that is the first step with getting established with care with Brightways, is that a consultation would need to happen. And basically that's where we're going to just verify insurance and then also ask questions about symptoms so we can, see who's going to be the best clinician or the med provider, who has expertise in these areas. We have a very large clinical team, and so we want to work to make the best fit. And then also to just making sure that we have all the services to meet their needs. So, we'll be asking questions about symptoms as well. There's also the option too of having the consultation in Spanish. You would, before you scheduled, you would click this link to switch it over to our Spanish speaking schedule where we have bilingual staff, and you would schedule with them instead for the consultation. So I'm going to go ahead and switch my screen back. Okay. So there's other ways to refer as well. You don't have to do it by our website. You can also call. There's the number listed there, fax, email. So whichever is best and most convenient. So as mentioned, we do believe in whole person care. PCPs, if one is listed, will get treatment plan updates. And then, we do have measurement-based results just to monitor progress, process, and outcomes. So we have progressive therapy options as well, some listed: CBT, EMDR, DBT, art therapy, play therapy, sand tray therapy. We have many others as well. So if there is a specific modality someone is seeking, you can always call and ask about, if we have a clinician who is practicing that or has expertise in that. And we're happy to advise. But yeah, we have many clinicians with different expertise. And so anything listed here, you can always just reach out about. And then again, it's just our whole model, which we've went over on the video, just, the referral, how it goes through. So we get the referral, and again, it doesn't have to be by a primary care provider. Everybody is guaranteed, once in services, a weekly appointment. And so with that, let's say in sessions, they have an increase of symptoms, they're needing a higher level of care than what we can provide, because we don't have crisis or after hours supports. We don't have wraparound supports either. We would make sure that that client is set up with that care. And then we would communicate that with the referring provider, just to make them aware. But yeah, if they're an established client, we're going to get them set up to that higher level of care should it be needed. But if it's not, then our whole goal is to, with treatment, stabilize symptoms, get them back to baseline so that they can, go back to their primary care. And of course, if at any point they have an increase of symptoms again, we're there and we're happy to help. So yeah, just another overview, like what's in it for you, how can we help? We have the closed loop referral system, two-way consultations where we do share those updates with primary care and work to treat whole person. We have direct scheduling on our website, and then just leading edge treatment with the modalities that we have. But yeah, thank you guys so much for taking the time, and we really appreciate it. Have so many great interactions with OSCI, and so this is really a great privilege. So thank you.
Thanks for the presentation, Autumn.
Yeah, thanks.
Yeah, and I hope that this information's been helpful to everybody. And thank you, Autumn and Beatty, for being here. And I'd love to open it up for questions from everybody.
I saw that it said Medicaid, but the Jackson Care Connect was on there. So is it not available through All Care? Or if you have Medicaid, is it?
Yeah, I know we're working on All Care. And then we're actually working to get all the other CCOs in network too. So yeah, we've heard that need from the community. And so that's too, like, we encourage people, if there's something not in network, to let us know. We'll reach out to our credentialing team and work to make that happen. So I know that All Care and Jackson Care as well, like that's being worked on.
Nice.
Thank you.
Yeah, and I'll make sure to share that update with you all once we are in network.
West, I think you were next. Oop, you're muted.
Blah, 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 blah. In the beginning of the presentation, you said that you did medication management. Was that right? And what does that look like? What does that mean?
Yeah, so for psych meds, we have medication prescribers, so psych nurses who are able to prescribe psych meds. It is all telehealth, except actually in our Portland location, we do have a provider who can provide those services in person. But all our other locations, it would be virtual. And then, yeah, I don't know, Vidi, if you have anything else you want to add about those services, or if, Wes, you have any like certain questions about them that we can answer.
So I'll add a little bit before to hopefully see if it clarifies. The medications that the med providers provide at Brightways, they're usually to address symptoms of anxiety, depression, any kind of like symptoms like that. That maybe sometimes your PCP can provide, but also sometimes they want someone specialized to also be able to provide those medications. So those are some type of medications that can be provided. And like Autumn said, they're all telehealth appointments. And in the Portland office, there's a provider at least once a week there.
Yeah, we do get a lot of referrals from primary care because, yeah, they're not usually comfortable unless, if there's not complications in there and someone's at baseline already.
I have a follow-up question to not actually, but the other presentation. So if someone is choosing to do a modality that requires in-person, I guess, treatment, is that an option? Like I saw you offer play therapy, sand tray therapy, the like eye movement thing. Like how does that work if you don't meet in person?
Great question. For some modalities, for the play therapy, and those ones are probably going to be mostly children, and they probably are going to be in person. However, you'll be surprised that there's some clinicians that are pretty savvy with their technical skills and just being able to engage the client virtually, and they just have their skills that they're able to utilize even some treatment modalities virtually. The EMDR, the eye movement desensitization, actually is a therapy that can be provided online. I am trained in that therapy, and it can be helpful and virtually. You know, like the setup of it, it can happen virtually as well.
Karima, I think you were next.
Yes, thank you. Just wanted to mention that from what you had said, Autumn, you also have services in Spanish,
Yes.
and that the website also can be used by Spanish speakers.
So we have Spanish speaking clinicians mostly. I mean, in the Woodburn office, we'll have in the Salem office, we have some virtually. So those are the locations that I am aware that we have Spanish speaking clinicians at this time.
Yeah, and same, that's my understanding as well. Telehealth and then those locations.
Yeah.
Thank you.
Portland too, if I didn't mention Portland. There's a Portland clinician that focuses on working with adults, and he is Spanish speaking. And just because our providers are in office doesn't mean that they can't provide telehealth services either. So there's the flexibility. I think the pandemic did open doors for virtual appointments for us in the counseling field. So that's a benefit because we're able to target the larger state and not just local communities.
Thank you. Cody, did I see your hand up?
Yeah, I just didn't know if it was gonna work with my mic acting up. Basically, I was just gonna ask if there's any potential or if you guys are working on getting more Southern Oregon for like in person rather than telehealth.
I know that in the works right now, there is for a location or request in Eugene. Southern Oregon, I know we do have a clinician, but she's virtual. So at this point, I am not too sure, but there is, you know what, the opportunities can always be there. But I know like Eugene is the next projected one south of Salem.
Yeah, and I'll check in about Southern. I just know we're expanding, like there's in the works several locations that we're hoping to open. So I'll check in about Southern Oregon.
Now, when somebody books with a telehealth person, are they getting somebody that lives in Oregon, or do you guys contract outside of the state also?
So we do have some clinicians that are out of state but are licensed in Oregon. The majority of our clinicians are in Oregon, but there are some that like therapists that are outside of the state. Our med providers, I think that most of our med providers are actually out of the state. So, but they're licensed to practice here in the state.
Thank you. And then another question is what's your turnover? Well, not your turnover rate. So down here, I've heard from community members that, you know, go in, they get an appointment, and they only get to see the person a couple times, and then the next time they go, that person's moved on. Now they have to start over fresh with somebody new, and so they never really get to make a bond with somebody, which makes it super hard. I was just wondering if you guys can speak on how that is with your group.
So Brightways doesn't only value our clients and our client care, but also our employees and being able to take care of employees to reduce turnover rates, because we do know that it does impact the client-therapist relationship and therapeutic process for the client. I can speak, for example, the Woodburn location, we've been there for three years. I had in the 3 years only 3 clinicians turn over, and we have like 8 right now. So it's been pretty consistent. And I would say that it is, you can expect pretty consistent treatment. Like Autumn was explaining, the therapy appointments are on a weekly basis. Some might wonder why on a weekly basis. Actually, it is a privilege, and it's nice that Brightways is able to provide weekly appointments, because there are some practices that might be providing bi-weekly, once a month appointments, just because of the high turnaround rates. They don't have enough clinicians to serve the populations that they're targeting. At Brightways, we have the opportunity to be able to provide weekly appointments. So a client, when they come in, that first intake appointment, when they are scheduled an appointment from intake onwards, they're saved that slot until their treatment is complete. I do have to point out and emphasize that we do have a late cancel no-show policy, because we also need to keep our clients accountable for their appointments. And so if individuals are late canceling or no-showing to their appointments 3 times in a 3-month period, they do lose their weekly scheduled appointment. That doesn't mean that they end services. That only means that they have to call on a weekly basis to see if their provider has any openings that they can schedule in. And so it becomes a responsibility of the individual to contact the provider to be able to be seen for an appointment, because they've lost the opportunity to keep their appointment. Once they are on a call-in basis and they start making their appointments again, maybe the clinician sees that they're consistent with calling in and making their appointments, they can earn their spot back again. But we do keep track of the late cancels, no-shows, because when an individual late cancels or no-shows a lot, it's not consistent treatment. We're not going to be seeing results, and we want to be able to provide the best treatment for individuals. And the way that we can do that is by attendance.
Thank you.
Mm-hmm.
West?
Yeah, I had some follow-up questions about that. These are kind of a couple questions, but like one of them was, I think you just answered, but how many clinicians do you have on staff? Did you say 8?
That's one of my locations. My smallest location is 8 up to 10. Our Portland location, for example, right now there is like 6, 7, 8 clinicians, but it has potential to 20 some clinicians when we are fully equipped with our whole teams. Our Salem has right now there is 5 clinicians, but that is our baby practice. We just opened that practice in August, but that one also is going to be under construction. And by that time that we're complete with our Salem location, there will be like a room for like 20 clinicians in there. But that's just only talking about the practices that I oversee. But we have the Central Oregon practices and the telehealth practice. We have, a lot of clinicians in the whole company.
Like
How many? Like,
71, it says in all,
in Oregon?
in Oregon.
Oh,
And
okay.
we consistently hire because that's our whole model, right? Rapid access. We don't want to wait list. We want people to get seen, get the care.
So are they what's the caseload per clinician?
So it really varies, but our clinicians have a caseload between 25 and 30, at least 25 is what the company requires, kind of to have like a full caseload, but some clinicians decide to add more appointments. But the other thing is that the clinicians get to decide what their caseload is. We don't want to burden them with higher caseloads, because that can also impact the care of like individuals that are on their caseload. And so for example, like when they have their 25 individuals or clients on their caseload, those clients have the same appointments every week until they're done with services. Yes, they can lose their appointments. Yes, if things change, you can, I always say as a clinician, and will continue to say this as I continue to support the clinicians, that communication is the key. And I think you guys will hear that in every aspect of your life. Communication is key. If you communicate with your provider that something came up, you need to adjust your appointment. Do it ahead of time so that it doesn't have a negative impact on you. And also to be able for your provider to be able to work with you so that they can accommodate. Sometimes they might not have openings at the time that you want, but if you kind of commit to coming and let them know that if they have an opening, if they can adjust you, they can work with that.
Are your clinicians, are they independent contractors or are they employees of the
They are
organization?
employees. Yeah,
they're full-time or
yeah, they're
employees,
full-time
benefited
employees.
employees.
Yep.
Mhm.
We try to take care of our clinicians so that they will not leave us, because we don't want them to leave us, because we want them to be able to serve our clients in our communities and be able to, you know, like not put barriers in the mental health care.
Oh, one other question. I'm sorry. I'm done. I know you talked about stepping up and stepping down. Could you give an example of what that means? And is that something like one of our community health workers might initiate, or is that a process that's simply not simply, but like between the PCP or the therapist and the client?
Okay, sorry, Autumn, that I'm like taking over, but I feel like these
No,
are
it's okay. I hear little.
Um, so the step up process, I mean, initially, really, when you come into services with us, your PCP might step you up to specialty mental health services. Not necessarily, because you can just do self-referral. But when you're in treatment and we only provide one time a week appointments, we do not provide crisis support outside of like office hours or wraparound services. We just don't have that capability at our practice. It's just weekly appointments. We do serve low to moderate acuity level. So that means, you know, like if an individual is going to be able to be stable with just once a week appointments, they're a good fit for us. If individuals are probably need more wraparound support, more case management, being seen more than one time a week to stabilize their symptoms, then that's when we probably need a higher level of care for intensive outpatient services, where they're able to provide more case management, wraparound services to provide support to that individual to stabilize their symptoms. An example of a step up would be if someone is you know, like suicidality, if they're at risk, their safety concerns, they're not able to safety plan, they just need more monitoring, more checking in. We are probably going to step them up to a higher level of care because we just don't have the capacity to support them. They might go into more intensive outpatient services or even like hospitalization, and then they might do their thing there, stabilize and everything, and they might come back down to lower level of care to us. And then we may continue to work with them until they reach their treatment goals. And then we step them down to PCP so that you reach out your PCP when you have any concerns. Sometimes PCP clinics, primary care offices, have behavioral health consultants that they do at least once a month check in with individuals that need some extra support. That's kind of what the primary care offices do. And that's kind of like the whole loop referral and step up, step down. I hope that's helpful.
Didi, you oversee some of the in-person offices. I won't name names, but one office down here in Southern Oregon, their office waiting room has kind of become like a haven for some unhoused here. And so for clients that go to access services there, the waiting room feels like unsafe and kind of sketchy and has steered some community members away. So I'm just wondering if you could talk about your offices, if it's kind of a similar situation or not.
Great question. Let me see if I'm able to speak to that. Thankfully, we haven't had like a lot of concerns with that. We haven't had that experience. However, we did have an experience this morning of just someone just kind of being in the premises and kind of just camping out in the premises when one of our clinicians walked in this morning. So what they did is just they called the non-emergency police number and someone came out, and then by the time I got there, which was closer to 9 a.m., they were gone. We haven't really run into concerns with that, but we're vigilant about that. We want to make sure that the individual, like not only my staff feel safe, but my individuals that come into the building feel safe too. So I don't expect my clinicians to take the immediate actions because I want them to attend to the individuals that they're serving. So that's more of like myself or facilities that will take care of them. So thankfully, up to this point, it has not been a concern.
Awesome.
Yeah.
Sorry, Wes and I are kind of dominating the questions. If anybody else is free to unmute. Cody, go ahead.
All right, so I know that All Care isn't a CCO that you guys are doing right now, but with us having all care, would you suggest like going in and if we need care or whatever, actually applying for it, and then your insurance verification team can actually check if they'll do it, or is it just like a no-go?
You would be like in those situations, be offered like sliding scale rate and see if that's something you'd want to proceed with. I don't know those rates off the top of my head. I don't know if you do, VD.
I don't
That's
either.
something I could look into and send. But that would be, you know, what would happen in that situation when we're not in network.
And the longer, like one of the things that Autumn was explaining earlier is that there are we're constantly trying to get credentialed with different insurances so that we're in network with them. So I mean that might be one that Autumn could take back to the table, kind of see, hey,
Yeah.
you know, we have a big group that has the individuals that they serve has this insurance. Is there something that we can do that we can work with this insurance?
Yeah, and all care, like we've been told by others. So obviously there's like a need there. So, you know, we're working on it. I know that for sure. And I'll make sure to update you all when we are in network.
Thank you. For people that are dual covered, Medicaid, Medicare, let's say you have all care, which you don't accept. Can you still get services using your Medicare then and not your Medicaid?
Great question. I don't know the answer on the top of my head. I know there's sometimes with Medicare and Medicaid and having both of them, it gets a little tricky and the, you know, with how it works.
Yeah, and I actually emailed about this today just to get you know, more understanding about Medicare. But as far as I understand, yeah, let me get more information. I still had some questions. So I'll email Casey and Karima with that
Thank
about
you.
Medicare.
That's more of a billing question, but
Yeah.
But it's a great question because I mean, those are the things that sometimes become barriers for individuals assessing like services. So great questions. And I appreciate all the questions that are being asked. So please.
Yeah.
Marvin. Oh, you're muted, sorry.
Do you guys or is Care Oregon Advantage? Is that one covered with you guys?
Autumn.
Do you guys know?
So
it's a what is it? It's an Advantage plan.
Is it through Jackson?
So, you know, the email that I received today actually had Care Oregon mentioned with Medicare, but I do need to just get clarification because I mean, as you know, it's the insurance world is there's a lot to it. So I don't want to misadvise. And I had follow-up questions based on this email. So yeah, I'll get that information and just knowing directly to that you have questions about the Care Oregon one. I'll make sure to get clarified.
And it's Care Oregon Advantage, correct?
Yeah. So you guys say just Jackson Care. If you have Jackson Care Connect, you guys cover Jackson Care Connect. Is that what it is, or did I get that wrong?
Well, we're not in network with Jackson Care Connect at this time, but we're working on it. Yeah. So yeah, I'll look into the Medicare piece too.
I was kind of curious. It sounds like there's individuals from Southern Oregon, but where's the other individuals from?
Well, I kind of know. I'll speak up if nobody wants to. I know, yeah, Southern Oregon, and then mostly Portland metro area would be.
Okay. I hope for the Portland metro area individuals, you guys have the insurances that we do take. We do have clinicians coming on board this upcoming month and the following month. And we will have openings like Not that we don't have right now, but we will have a lot of openings because we have 4 clinicians coming on board from now till the end of the year.
Nice.
Mhm.
Josiah?
Yeah, I didn't see Regents Blue Cross Blue Shield on there. I was wondering, are you guys working on them? I've heard that they're hard to deal with sometimes, so I was just wondering.
Yeah, I don't know the extent of our relationship with Blue Cross Blue Shield, but I do know we're not in network. There was a time that we were, and I'm not sure, the developments of why we aren't anymore. But yeah, at this time we are not.
Do you guys know, so for people that are out of network, do you know if there's any funding available for mental health appointments?
We have a sliding fee scale that individuals can inquire about.
Yeah, and I wonder about the funding piece too, just about other things outside. That'd be something really interesting to look into. So thank you for that suggestion.
Yeah, because even I mean, even a sliding fee can still be a barrier for some.
Yeah,
Mhm.
yeah.
Just wondering if you guys knew anything.
Oh, yeah, because it is a process, that they have to go through their formal process to determine how much it could be. So it is, and that is the only kind of like other option aside from kind of just the flat like rates that we provide for cash pay individuals. Mhm.
Yeah, and our goal is to destroy those barriers. So I really thank you for bringing that up.
Mhm.
That's something that is worthy of looking into.
Out of curiosity, do you know if somebody did not meet the sliding scale and just was paying cash, what weekly appointment would cost? Just at the normal rate?
I'd have to consult with our billing team. I don't have that information like readily available, and I know things change. So anything I've gotten in the past, and it hasn't been in the near past, so I don't want to quote what I've gotten like months ago. I'd rather want to like just confirm and check in with them.
So I do have the rates. I just pulled them up because
Oh, cool.
I was able to pull up one email. So these are for non-OHP individuals because we are not able to charge OHP individuals.
Yes.
For an intake, it is $225. For a 60-minute appointment, 175, and then 45-minute, 131, 30 minutes, 87, and there's option if there was a group option available that $45. So it can be a little pricey still.
Cool, thank you.
Mhm.
And West, I think I saw your hand up.
Yeah, I was kind of these are questions actually for the group. And I guess I would ask this question, but you don't have to respond if you don't want to. But one question I have is, of the people that are on this call, how many participate in therapy? And then the subsequent question is, well, maybe they're rhetorical questions, is what are the barriers? Like why don't you participate in therapy at the moment?
I was participating, but the only option that I have is is actually the facility Casey had mentioned, where it's unpleasant to go there, and then the therapists are always leaving. So, and it's the only thing covered through my insurance. So that's my barrier.
Thank you for that.
Victor, were you trying to unmute?
No, I don't go to therapy or anything like that.
I don't go to therapy, but for some reason, I find it kind of, well, I mean, obviously talking to somebody always helps a lot. I try to reach out a lot, but I've been talking to this lady. Her name is Tiffany, but she calls me every week about my how she's my dietitian. So she calls me, hey Marvin, how are you eating? How are you drinking your water? You know, and kind of for some reason just talking, you know, her, and like right now she's in Italy, she's went on vacation, so she didn't call me this week. But I mean, even her calling me and talking to somebody else and just kind of checking up on me, seeing how I'm doing. I mean, it helps me. I mean, it kind of gets me like, okay, cool. Now, so when I'm eating now, like, I don't know this lady, but I think about Tiffany. Oh, I gotta drink my water. I, you know, more take two fruits, two vegetables. You know, I'm thinking about that throughout the day. So it's just like, I'm not really that depressed, but I could just imagine if somebody's depressed, if somebody even talking to somebody, and if somebody's could get him the right way. I mean, I haven't tried it. I mean, I haven't needed it, but I probably gotta go check out the place they're talking about. That that it's not so welcoming, but I want to go check it out. With everybody in the front, you know, with that's
Give us the scoop after.
yeah, I'll let you guys know. I'll be like, no, Hannah, no, they don't know what they're talking about, man. No,
Yeah.
no, I gotta check it out. If my insurance covers, I wouldn't mind checking it out, seeing what's up, what's it all about, you know, because it does help. So, anyways, but I like talking to people.
For me, there's just been a lack of options. And I guess also just kind of the stigma around it has been a barrier.
I do speak to somebody on a weekly basis right now, and sometimes every other week when things are going better, but I do speak to a therapist, and it does help. I deal with PTSD and depression and anxiety.
Thanks for sharing, Josiah. Cody, you're up.
Yeah, it's one of those things that I've done in the past, and I'm actually looking to do it again because I got so much going on in my own personal life right now. But it'd be nice to shed some of this stuff. But it sounds like there's still a lot of barriers for the people down in Southern Oregon with the CCOs, and it's every time like you come against this stuff, it's almost defeating, and it's like, well, why even try? I'll just deal with it. So that's kind of where I get placed in my mindset, is if I run against a barrier, then it's like, okay, I know how this is going to go, so I stop. It's just not worth it to me.
Thank you all for sharing, and I would just kind of I'll share a little bit to my personal experiences. I, as a professional, that like do believe in therapy, and that's the reason that I got into the field. Because if I didn't believe in it, I don't think I would be in it. And one of the reasons that I got into the field is because I enjoy helping individuals find their full potential and develop it. I do see and believe that individuals are very valuable, and sometimes things in their lives happen that impacts them, and it stops them and slows them down in being their full potential. And so I like to help and provide individuals with tools to be able to reach that again. But as a professional too, I mean, it doesn't mean that my life is perfect or everything. And there's been in the past where I've tried to seek services too for just my own processing, and it's been a barrier for myself to have access to a therapist. And I have to say that because of those barriers, I had to seek out other means to getting the support that I've needed. And I think that that's what it is, like sometimes individuals are able to find within their own support, their natural supports, the support they need to help them through challenging or difficult times. Other times you do need more specialty care, and that's where professional counselors or therapists come into play, because your natural supports, it might be more than they are able to support you, and you need more specialty care. So there isn't anything wrong. I mean, there is that stigma of why do you go outside your family or your natural supports for that support, but it is sometimes we just do need it. Sometimes being able to talk to a professional that doesn't know us, like our close friends or family, is helpful. Like Marvin was saying, just talking to someone, having someone check in with them, that is therapeutic, because as he's going through his daily life, he's thinking about those conversations, and he's being mindful of what is being shared during those conversations, which helps individuals. And it's really, I mean, there's so many different types of therapy. And there's so many reasons why individuals come to therapy. Some of the main reasons that we hear about that individuals seek services is anxiety, depression, trauma. Those are the main big ones, but there's other things that individuals don't realize impact your daily functioning. Adjustments. We're constantly, I mean, we're living in a world that's constantly changing, and even we go through different experiences where we go through adjustments, and even we don't even realize that some smaller adjustments or bigger adjustments, how it impacts us. But I mean, we might recognize that it impacts our eating, it impacts our sleep, it impacts the way that we're interacting with individuals. So we have to be mindful and look out for those subtle things that are changing our lives. We're becoming more irritable, and maybe we're like needing just the tools to help us get through that adjustment, to learn how do we manage how do I manage my feelings? What do I do to distress? How do I do to better, maybe I don't know how to express my feelings because it was something that was never modeled or showed in my family. So I don't know how to express how I'm feeling. And so it's just coming out in actions that are not helpful for myself or for those around me. And so therapists provide individuals with tools to be able to do those basic skills that we sometimes need fine tuning, or we just need to learn, As a child therapist, I've taught parents learn how to play and interact with their child, because it was a skill that they did not learn as children or growing up with their caregivers. And so it's sometimes, I mean, there isn't anything wrong with it, and it's nice to see the shift in the caregiver and also their child. And then there's clinicians that help you process trauma. You might have gone through difficult situations, and you might not even realize that trauma impacted you because you probably stored it in the back of your head or tried to forget it. But if you think about something that happens in your life and you got a strong reaction to it, you might wonder, where did that come from? And if you start really thinking very closely, you might tie that to a traumatic experience that you had earlier in your adult life or in your childhood, and you didn't even realize that it was there. And so a therapist can help you process that trauma. And I've helped adults process different traumas that they've experienced in their childhood. And it's literally like healing their child's self. And it's such a beautiful experience to see individuals healing. And so I just wanted to share that because I don't know what your guys' backgrounds are and knowing what mental health is. I think there's a lot of misconceptions, and mental health and just the therapeutic relationship is really tailored to you specifically as an individual. We have an intake process, we have a treatment planning process, and then we have the ongoing therapy appointments where the work takes place. But it's not only, and a lot of misconception is that the therapist as a professional has the answers to my problems. Incorrect. You as an individual actually has the answers to kind of what's going on in your life, because they're not necessarily problems. They're just challenges that you might experiencing or things. And your participation and being open and feeling safe. I mean, it's supposed to be a safe environment, but you opening yourself up and trusting. I say, I thank individuals that I've worked with for entrusting with me their life stories because they're sacred, and in you doing that, it really allows the therapeutic process to play out and for you to get where you want to get. And that is different for each individual based on what they're coming in for. So I just wanted to share.
That was actually really clarifying, and also just touched a lot of spots in just my personal life, having the spinal cord injury and going through the trauma of that and loss of mobility and all that. So thank you for touching on all that.
I'm gonna hop in without raising my hand. I'm sorry.
You're good.
Do either of you guys think it would be beneficial for like myself? I'm just gonna speak for myself because I know like I am personally seeking to get like a therapist, but would it be beneficial if I called All Care as a patient itself and said like, hey, I'm looking to get established with Brightways, like, can we make this happen? Like, would it help like all our Southern Oregon team to be able to like reach out to All Care and like help get this ball rolling?
Hey, any advocating that you can do, I think it helps, to bring Brightways into the radar of your insurance, I say go for it. Go for it.
Agree. Yeah. Maybe it will get things going faster,
Mhm.
right?
Yep.
Anybody else can feel free to unmute.
Yeah, please. We're here to answer questions. If you want to ask something, just we welcome all the questions that you have. Yeah. When
So
Autumn
that-
was talking that it was only going to be 15 minutes and then maybe some questions. I've been in kind of like these presentation. I was like, yeah, no, it's gonna get good with the questions.
That's where the potatoes are.
Just from my past like therapies, like I know they were very like specific, like divorce counselors, family counselors, you know, like is there, obviously I know like you talked about doing that initial kind of credentialing, figuring out like what you need or what symptoms you're looking at. Like is there therapists that's like specifically handle like newly injured people that like they can help them do that, or like somebody that's been dealing with like a long-term disability? Is there clients or therapists like that?
So our therapists have different specialties, that they might have. And sometimes I don't even know their specialty is because they haven't shared it, but we do have a clinician bio spreadsheet that outlines specialties that therapists have indicated. If you go into our website, you will see the bios for all of our providers there, and they have all in their bios and kind of like share a little bit of what their focus might be or therapeutic treatments, modalities they might use in their clinical practice. However, when you do come in for an initial assessment, they're going to ask you a lot of like information. What is the chief complaint? What's the reason that you're seeking services? Because in order for us to be able to bill insurance, there has to be a billable diagnosis that we do give or assign to you to help understand the what it is that we're treating, and that's where the insurance comes into play. Based on the need that the individual is presenting, the therapist, along with the individual, might decide what is the best therapeutic modality. The clinician has an idea of what might be helpful and will present that to the client. However, if it's an area they might not know, they were still going to try some therapeutic modalities to see that they might not specifically say have worked with a disability, but they know how to address symptoms that might be coming up. And that's what it is. And I wanted it to mention that, like, it might not necessarily be like working with, some of them might not have experience working with a disability, but might have experience working with the symptoms that come with the disability or the things that you're encountering. And that's where the tools that they provide, it's helpful. However, if it is really something very specialized and they know that there is a colleague within the practice that has more specialty in that area, they can do an internal transfer to that clinician so that you could get the best care, because really your care is driven by you, not by the clinician. And I just want to make that very clear that your treatment is guided by you. Yes, it will present their professional recommendations and everything. However, you need to feel safe. You need to have that therapeutic relationship. And also you have a say about the treatment modality. Sometimes individuals come in and they say, I want this specific treatment modality. The clinician might slow you down because there are things that we do have to take into account before we jump into a therapeutic modality. And they want to make sure that you have everything to get there. And so I just wanted to share that with you, but you can always say, hey, this is not a good fit. Also, is there other clinicians that I can kind of see if I am a better fit with? I hope that answered your question.
Yeah, it does. And then if you start working with a certain therapist, is there an easy say you don't have that relationship or that click, quote unquote, with that therapist? I mean, is it easier? Is it still a thing to be able to transfer to a different therapist?
Oh yeah, I mean, you could do it at the beginning. You could say, okay, I'm gonna give it a couple more tries and see, maybe it's just, me. But also please bring it up to your clinician and have that dialogue, because that feedback to them is helpful. And also if you guys have tried and say, okay, let's try it a little bit more and it still doesn't work, you're still feeling like it doesn't click, you always can request a transfer.
Cool.
Mhm.
A little follow-up to Cody's initial question. Is there a specialty that you would recommend for somebody seeking services for like loss of mobility or new to disability?
That is such a broad question, because then my initial response is, well, I need to learn more, because that can mean something different for each individual coming into treatment. So really, it is a broad topic. And so when you're doing that initial assessment with the provider, you're going to be able to share, I mean, yes, there is that loss, and what comes with it. What are you experiencing because of that loss? How has it impacted your daily life, your relationship, like with your family, your friends, your social life? All of those things are explored, and all of that information is needed so that your clinician can better have make a case conceptualization of what's going on, and give them a path of how to support you in your treatment.
So regardless, it's very individualized then.
It's very individualized, because what that could mean for you could mean something different for Cody, and it could mean something different for Josiah.
Gotcha.
So I hope that makes sense. I mean, I didn't really answer the question because I don't think there is a one answer fits all. It's very individualized.
It actually made a ton of sense. Thank you.
Okay, I got one more question, and it's based on like with me and my disability and some of the things I deal with, but is there family counseling? Because I have two daughters. I'm a single dad. Is there some sort of like family counseling where I could get my daughters in the same session with me?
Okay, great question. And before I answer your question, I'm going to make a statement. I knew the practice that we were going to do this presentation with, but just looking and sitting in this screen, I would have never known anyone has a disability.
Right.
So you see how, because we're having such a dialogue, and it's going to present very differently. And so that initial assessment and kind of understanding your story and what it is impacting you, it's really going to help the clinician to understand, because it looks so different from everyone. And yes, it's going to be different. I mean, I think I would have maybe realized it more if we would have been in the same room. But right now, I would have to say I have no clue. I mean, I am hearing things, but I would have not just noticed it right away.
For sure.
To your question, so we do provide individual counseling for individuals. However, we do, if there is a family member or someone else in your life that is important, that can need some like education of what is going on in your life and how to like work together and support, because it is impacting that relationship, they can be welcome into the therapeutic process at a time where you and your clinician decide is the most appropriate. They might want to like spend some time working with you, creating some baseline skills and kind of just that rapport early on, and prepare you to be able to then have those individuals join your therapy sessions. So yes, there's that option.
Thank you.
I'm on a roll, so
I-
the questions.
Marvin, I just have to say, I was thinking of Tiffany drinking my water. So she's making an impact.
You
Out of
can
any
think
other
of
thoughts,
that night
or-
when you eat your pork chocolate bars and Nutella.
Yeah.
Yeah.
I don't. I feel this was really productive, and I've taken a lot from it. And I really appreciate like the conversation about barriers coming up, because that like just that is what we want to destroy, right? Like we want to get rid of those. So it just gives us something to work towards. And so, yeah, thanks for bringing those up and just making the time. And yeah, no, it was great to connect. And yeah, thank you.
I have another question. Like, for example, do your therapists talk amongst each others? For example, like you guys have a meeting all together, say, well, with my client, you guys, not specifically of clients, but like, do you guys ever get together and talk about, issues that you guys are having? That way you guys keep, with this problem happened, I told them this and this worked out. And do you guys ever do that, or?
Yeah.
Or no?
So we are in our clinics, we have the consultation model where there is a consultant in the building. As the practices grow, there will be more consultants to be able to support the clinicians. But right now they have like group consultation once a month where they come and they might share cases, kind of get feedback, what can I do? And then that's where they'll share kind of like what tools they have used or how they've approached a certain situation. So yes, they do. It's very helpful, and they can do that in an individual basis, but they have the opportunity to come in as a group as well.
Yeah, because I was just thinking about it because I wish my doctor would probably talk to Casey's doctor and we'll talk to Hannah's doctor. That way they could like, oh well, paraplegic. This is the issue that I've had with him, and kind of talk about it. I mean, obviously they ain't gonna do that. I don't think they do that, but I mean, I was thinking about it because just I know that we all have different issues, but there's some issues that are kind of like the same
Mhm.
almost. I would say that
Yeah.
because some issues we have, I know what issues we have that we all have those issues, like
Mhm.
gets us
Yeah.
frustrated and stuff, but um yeah, anyways, it'd be awesome. So I mean, that's just one thing I would say. I would just talk amongst each other because I know people in wheelchairs, we all have different issues, but there's a few things that we do have in common that if you guys
Mhm.
all could talk with amongst each other, if we ever get around to talking to therapists.
So they do come and do group consultations. I also do want to emphasize that part of being the whole care services that we model that we have, we recommend and encourage our providers to also reach out to other providers that might be supporting you in your life professionally. We would get a release of information so that they are able to consult, because when we look at it, some individuals have a whole team of professionals working around them. And if they work in silos, like if they're so disconnected, they're going to miss what, like kind of supporting and understanding the whole picture. So we do recommend that they seek out to the different providers that the individual might be connected to so that they can better understand what the need is and provide their perspective as well. I had for example, a teenager that I was working with, and she was always like getting so sleepy and so weak. And I was like, have you had like a physical checkup recently? I think you might want to ask your doctor about being anemic, because the symptoms that you're presenting for me is that comes to mind for you. And she was like, yeah, I'll follow up with my provider. But of course, I was like, okay, I'm talking to a teenager and the parent. I might as well had a consultation with the primary care, because at Brightways, with some of our primary care clinics, we already have like a consultation once a month where we staff and consult about patients that what we might be sharing. And so at one of those consultation meetings, they say, hey, I met with so-and-so, this is the presenting symptom. I was curious about being checked out for anemic. And thankfully the doctor listened, they followed up, and they're like, yep, sure thing. She was anemic, and they were able to address the concern. And so it is very important for providers to talk to other professionals to support the individual. And that's the whole person care right there.
Thanks for sharing that.
Mhm.
I want to be respectful of everybody's time. I know it's a little after 6 now, but Autumn and Vidi, I was wondering if you guys would be willing to do this again, maybe early next year. And because there's a lot of people that weren't able to come tonight, and I think it's such an important topic, and you guys shared some really good information. I would love
Of course. I would love
Yeah,
to.
we'd love to. Yeah.
Awesome.
Can I say one final words and thoughts? I promise I'm
sure.
taking a long time. I just want to say thank you so much for everyone that attended, for everyone that participated, that asked, for those that are just being here listening. I know mental health is a big topic, can be a tough topic for some individuals. But I also want to say, I know that there are things that might be stopping you from seeking mental health services. And when you do have the courage to seek mental health services, which I do encourage, I know it can get discouraging with different barriers that you might encounter. Please, 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 I know that there's those barriers in place, but I hope don't get discouraged and don't give up, and try to continue to see if there's a way around it, because it is important. And as a professional, mental health professional, like I do believe and see the benefits of like getting mental health support for just your well-being, and to be able to have a better quality of life with the different circumstances and realities that we all bring. And so I just wanted to say again, thank you so much.
Thank you so much for all the great information.
Mhm.
Yeah, thank you guys.
Autumn, I'll follow up with
you.
you. Thank you so much.
Yeah,
thank
I'll
you.
follow up. Talk to you later.
All
All
right,
right,
sounds
take
good.
care, y'all.
Thank
Have
you
a good evening,
guys. It
everybody.
Bye.
Thank you. Bye-bye.
was a
Bye.
pleasure. Bye.